Good morning, everybody, and welcome to our annual Arkansas Center for Health Improvement Health Policy Board and Center Appreciation event. Thank you all for joining us. This is a beautiful day here in Arkansas, and I think it's a great event that we're going to try to put on here with all of you virtually together. Your center is healthy. We're moving into our third decade. This has been an unprecedented year, and we are in uncharted waters, as are all of you. But we're glad that you could come together with us today. We want to thank each of you for being supportive of our center and for helping us strive to meet our mission of being a catalyst to improve the health of our Kansans. And in particular, I want to thank our sponsoring organizations and their leadership: Arkansas Children's with Marcy Doder, the Department of Health with Dr. Jose Romero, Blue Cross Blue Shield with Curtis Barnett, and UAMS with Chancellor Cam Patterson. It has been an interesting and unprecedented year. A year ago, we were fighting to keep Juul electronic cigarettes out of high schoolers' hands. We were working to try to get e-cigarettes and vaping added to the Clean Indoor Air Bill. We were using the data that we have in the Transparency Initiative to try to look at the design of a new delivery system and financing model for rural Arkansas and how to meet the explosive demands of healthcare needs in the northwestern part of the state. And we were actively, fully engaged with our partners through Healthy Active Arkansas to strive to address the obesity threat that is with us and pretends to be a major challenge going forward. So we were rocking along, and as all of you know, early this year, we were all challenged with the emergence of COVID-19 and a global pandemic. Your center responded. Our 45 employees did what we do best. We leaned in and we tried to turn data into information to support local decision makers. We developed, in partnership with the health department, some analytic surge capacity that we on a weekly basis provide local COVID-19 information now for communities, for school districts, even down to the zip code level. This has been in response to frequent requests from mayors, local leaders, school superintendents, teachers, parents, others, to have information about their locale so that they can make more informed decisions. Along that path, we have provided some interpretation for the enormous volume of information and, unfortunately, disinformation that has been put out that has caused confusion and made the response to the COVID-19 threat even more challenging. And through this, we've developed new partnerships. We have strong relationships now with weekly or bi-weekly updates with the Northwest Arkansas CEO Forum, the Arkansas Municipal League, and through them, the chiefs of police, the fire chiefs, the community development efforts, the Arkansas State Chamber of Commerce, and the Arkansas Association of Education Administrators. So we are striving to meet the goals that you have set for us. It is a challenging year. We're all in this together, but I think we are trying to make our response a part of a successful response here against the COVID-19 pandemic. This is not to say that we didn't have other epidemics underway. We were fighting the opioid epidemic, and we are addressing the obesity epidemic, and we have a financial challenge on our healthcare system. None of those have gone away. We are just coming together to actually try to meet them head on moving forward. I want to thank and recognize our board on which I'm speaking on behalf. It's a 21-member health policy board that helps guide and support our work. I see many of the faces on our effort now. This board has been with us over the last 2 decades. It's a self-perpetuating board. It's diverse and reflects the state. We have large and small businesses. We have primary and specialty care providers. We have hospitals and health insurance companies. We have the diversity that represents the state from a political perspective. And this board is really critical for us. It gives us guidance, it gives us advice, it gives us reaction in our pursuit of opportunities to improve the health of our Kansans. This year, we want to recognize 3 board members who are stepping down that have made crucial contributions to our center's success. That's Dr. Susan Hanrahan, Mr. Bob Shoptaw, and Mr. Ray Montgomery, who is serving as our chair over the past 2 years. Susan has served on our board since 2006. She was a former board chair. She is currently the Dean of the College of Nursing and Health Professions at ASU and has led that school to become nationally recognized and a premier educational opportunity. She's a former chair of the Arkansas Tobacco Settlement Commission and numerous other activities. Susan, let me turn to you for a few comments. Thank you for your service on our board. You never quit working with ACHI, so you're not going to disappear. You're just not going to be on our board in the coming year. So Susan?
Well, thanks, Joe. I appreciate those remarks. It's certainly been a privilege to meet and interact with so many talented people that have been on our board, like Dr. Joe Bates that I see on our call. Hey, Joe. This board really does care about health and safety of Arkansans, and I'm glad that that's remained kind of a top ACHI priority. It's so important for the state. You know, I love policy. I'm going to miss my time on the board. I'm going to miss listening to everybody's words of wisdom because there's a lot of them, but hopefully we'll get to meet again post-COVID. I certainly want to thank you very, very much for this opportunity to serve.
Susan, thank you. And for the members, usually we have a great get together that brings the mixture of folks that support ACHI together in the fall. It really is a unique time that we have folks that don't usually cross paths, but because we have such diversity and support, we will do that again as soon as it is safe, but I want to thank everybody for being with us today. Another long-term member of our board, Bob Shoptaw, he's actually served twice, originally from 1999 to 2002, and then rejoined us again in 2012. He's past president and CEO of Arkansas Blue Cross Blue Shield. And I want to note, Bob in 2003 was really an anchor reason that ACHI became an independent voice of our sponsoring organizations, and actually can serve as an advocate for the average Arkansan moving forward, regardless of institutional goals and desires. So Bob, you've served on the Governor's Rural Health Advisory Council, a number of other things. We have benefited from your sage advice from a insurer's perspective and from a large business supporter. Thank you for your service. And if you'd like to say a few words, please feel free to.
Thanks, Joe. First of all, I want to express my appreciation for having had the opportunity of serving on both the ACHI administrative committee as well as this policy board at various times over the years. Reflecting back on the evolution of ACHI, strikes me that one of the major guiding principles that we adopted at the outset was to really rely, to the extent possible, on an evidence-based approach relative to us formulating policy or providing input to policymakers within the legislative or political arena. I think that's really served us well over the years, and I have no doubt that we'll continue to work along those lines, being really fortified and buoyed up by the type of data analytics and the maturity that we've seen in terms of our internal operations within ACHI. One other observation is that obviously in terms of health policy, you know, you cross over into politics just by the nature of where the creation of policy comes from, the funding of health policy in the state, and then the oversight. I think ACHI has been very balanced in terms of dealing with the political dimension of health policy that we've been involved with, without the policy board itself becoming political within its own ranks. And to me, that's a major strength that we've enjoyed over the years. And I would only hope that that could continue into the future. Joe, again, it's been great working with you and staff. Very much appreciate the opportunities that have come my way. Thank you.
Well, thank you, Bob. And for everyone on, you can tell now, the other person that we've got that's not with us this morning is Ray Montgomery. He has served on our board since 2011 and is currently our chair. He's hosting a congressional delegation at Unity Health, where he served as president and CEO, retiring last year after 30 years of service. Ray has actually served on the American Hospital Association and received the Alan Winthrop Memorial Award, the highest honor for a state hospital administrator awarded by the American Hospital Association. So Ray's not able to be with us today, but I know his long-standing support will continue for our center, and he wanted me to relay his appreciation for everyone on and his commitment to to the purposes of our center. It's time for us now to turn to what our board usually awards. I will do it on behalf of the board this morning, which is our Dr. Tom Bruce Arkansas Health Impact Award. This was an award established by our board now 6-7 years ago to recognize the lifetime contribution of courageous leadership and sustained record as a catalyst to improve the health of Arkansans. Dr. Bruce, as many of you know, was a national leader who became known as the father of community-based public health. Most of his career was dedicated to improving the quality and access for underserved and rural citizens of the state and of the nation. He was deeply concerned by the lack of physicians in the rural parts of the state and of the access of individuals from the minority populations to be able to gain access to high quality care. He and his wife, Dolores, paved the way with an initial challenge grant to get ACHI started from a seed donation. He also subsequently, served as the College of Medicine Dean, but he served as the founding dean for our College of Public Health, founding dean for the Clinton School of Public Service, and was a longstanding supporter and committed individual for ACHI and our core values of trust, commitment, innovation, and initiative. Our board established this award to unofficially have the Public Health Hall of Fame memorialized. There have been several recipients. Dr. Joe Bates was the original recipient in 2016, followed by Dr. Jocelyn Elders in 2017. Subsequently, Ben Owens of Jonesboro and Dr. Kent Westbrook in 2018, Amy Rossi of Arkansas Advocates last year. And this year we had several nominees and our board selected two that are clearly representative of the Dr. Tom Bruce Award. First, we want to recognize Kathy Grisham. She was nominated by Tim McFarland in the Northwest Arkansas CEO Forum for her work in the Northwest Arkansas Community Clinic. She started it in 1998 with a $300,000 budget, mostly a volunteer church-based organization. Over the 20 subsequent years, she expanded that center to be a major, if not the primary access point for underserved communities and communities of color in Northwest Arkansas, particularly the Hispanic community and the Marshallese as they have grown in both presence and in need. Overcoming the barriers of poverty, language, location, the clinic today has a network of 13 clinics, almost 300 employees, and a $24 million a year budget. She retired last year and now serves as a consultant to the clinic and continued anchor in the community. Let me turn, we had the opportunity to go up and talk with both Kathy and many of her supporters there. Michael, let's pull up the video and share with our group a little bit of Kathy's story.
High school, they gave us aptitude tests. Mine came out to be an administrator for a nonprofit. And I thought, oh my gosh, how boring that would be. So I ran the other direction, and I was a journalism major, and I worked for a couple of different papers. And when I was asked for this job, it was like, oh, an administrator. Huh, funny, I've been running from that for 25 years.
The big thing to know about Kathy, and anyone that knows Kathy absolutely knows this, Kathy is where passion, attention to detail, and intelligence all come together.
She's so dynamic. There's never a moment where she's not thinking about something else she wants to do.
She was always an excellent business person. She was very well organized, and she also had a deep heart for social needs, and especially for the needs of those who sort of fall between the cracks.
When I started, the clinic, the volunteer clinic, had a budget of about $350,000, and we were seeing maybe 1,000 patients a year. And now the clinic has 15 sites, 5 medical clinics, 2 dental clinics, 8 school-based health centers, and a budget of about 24 million, which just kind of happened over time. It's how it seemed.
She knew that Northwest Arkansas needed expanded health care even though the rest of the state thought Northwest Arkansas was rich and didn't need anything. And she knew differently, and she wanted to make certain that it was not ignored.
When I first started here, there was 12 employees total, and they were kind of just seeing random patients, but Kathy really wanted us to focus on the unmet need in the area.
We were working with a population that most of the medical community wasn't seeing and really didn't have their pulse on it.
So once we had the Spanish-speaking population, it kind of just went like wildfire. Like they really entrusted in us, and they believed in our mission, and they knew that we were here to help them. And then the demographics in the population even changed some more in Northwest Arkansas, and a lot of Marshallese moved into the area.
She was determined that we would have first-rate, state-of-the-art pediatric dental.
It was kind of like, you build it, they will come, and they did.
And we had a lot of the children that we started treating in the late 90s come back to us with their children for care. And they had done wonderfully. They had taken our hygiene information and did right by their own children.
So then that's when Kathy actually hired a grant writer for us to become the 501c3 that we are and become a federally qualified health center.
We were looking to expand, and how would we do that? How could we hire providers to care for people when we were charging $5 a person for care? So we started doing research and found that there was a community health center world out there that hadn't really reached the western part of Arkansas.
Kathy was part of that tireless team, the leader of that tireless team that brought the health center model to Northwest Arkansas and grew it into one of the top federally qualified health centers in the whole country.
She's been able to look in every corner and find every resource to enable her to keep the community clinic going, and has been very successful.
So to be able to create a program that was very hospitable to Hispanic and to the Marshallese neighbors, one where they felt confident, they felt heard.
More than probably about 80% of our staff now is bilingual, if not multi-languaged.
We also put up maps of the Marshall Islands so that people could show us where they came from.
She was always like 10 steps ahead of everybody else.
She was born to be a boss because she can get everybody lined up doing what they need to do for a singular mission.
It takes a very capable CEO who's pretty tenacious and resourceful, and, to make all that fit.
She gravitated to me because she was all about the mission and extending beyond her footprint with that mission and helping the whole state.
I knew Dr. Tom Bruce. He was a wonderful inspiration to many of us in terms of community health and taking care of health disparities and impoverished populations. He was a wonderful leader.
Kathy reflects the lifetime commitment of Dr. Tom Bruce, who was a pioneer on community public health and primary care, who worked diligently to improve the access and quality of care for low-income Arkansans and marginalized across our state. Kathy has those attributes, and it fits her to a T.
We're a better community for sure, thanks to Kathy Grisham.
I'm really proud of her for getting this award. It means a lot.
Kathy, on behalf of our Arkansas Center for Health Improvement's Health Policy Board, I want to congratulate you on being the recipient of the 2020 Dr. Tom Bruce Arkansas Health Impact Award. Well-deserved. Congratulations. So I had the opportunity last week, appropriately distanced, to go up to Northwest Arkansas, and with Kathy and select members of her clinic, Tim McFarland and her family, including her beautiful granddaughter, was able, on behalf of the board, both to present Kathy with a gift and also the Tom Bruce Award itself. It was an honor to be there. Kathy, congratulations. Let me give you a chance to make a few remarks here upon receipt of the Tom Bruce Award.
Thank you, Dr. Thompson. I am humbled to follow so many who have had such profound influence in bringing healthcare to those in need, most in need in Arkansas, and to share this recognition with Dr. Zini. Our work in Northwest Arkansas for the last 20 years has been merely a journey of becoming aware of the needs of our neighbors and figuring out a way to address those needs. Our first priority was to make quality dental and medical care available to neighbors who had been blocked because of their income, their language, and their cultural differences. And that's still an important mission to us today. We saw needs, we struggled to find a way to expand our work, and we struggled until we became aware of the Community Health Center program in Arkansas. That nationwide network began in the 1960s as a part of the war on poverty. Today, 29 million people in the United States get their health care at a community health center, and over 240,000 in Arkansas get their health care at a health center. Our first grant from the Community Health Center organization kicked off our ability to expand services. And then it came to our attention, as the needs came to our attention, we looked for ways to address those needs. We created a prenatal program to decrease emergency room deliveries. We integrated behavioral health into primary care services. We worked with a local pharmacy and the federal 340B program to make medications accessible and affordable. And by the way, the 340B program is under threat today by the very manufacturers that provided it. This year, the pandemic has thrown back the curtains of almost a quarter of our population who experience what research experts call social determinants of health. In most cases, it is our essential workers who are most affected as a group by the pandemic. We need to address the inequality that exists in our state and in our country. I wish I had known Dr. Bruce, as many of you did. I feel he would have been a champion of the work we undertake. What we do fits how he sought to bring the highest quality health care to every region and every demographic in our state. Thank you so very much to ACHI and its board for this award. I gladly accept it for all at Community Clinic who have worked so diligently to bring quality health care to all people, no matter the color of their skin, education level, their language, or their paycheck. Thank you.
Thank you, Kathy. A virtual applause for you from everybody on the line here. Our board had another nomination from Senator Missy Irvin, Dr. James Zini of Mountain View. Dr. Zini and his wife started the practice there in Mountain View in 1977, providing primary care and community services for that rural community. Dr. Zini is nationally renowned by Osteopathic Medical Association for his leadership in that organization, for bringing osteopathic medicine here to the state. He's been instrumental, in teaching and mentoring students, bringing them there. He has an award in his name, the James Zini Young Physician Award, given to DO physicians for contributions to the profession. He and his wife are institutional members of that community, but not only in that community, he has bridged the public health community long before we had the threat of the pandemic and the need that we have now, having been the first osteopathic physician to serve on the Board of Medicine for the state of Arkansas, and continues to serve as the county health officer for Stone County there in the beautiful part of the state. So with that, let me bring up a video of Dr. Zini, a little bit about him and others that see him work in that area of beautiful Mountain View.
I'm James Zini, DO. I'm an osteopathic physician in private practice in Mountain View, Arkansas. I actually pastored a church the 4 years I was in medical school in Kansas City. It's actually my wife and I, because we've been a team since we were young teenagers, and I could not have done it without her. She, in fact, to this day, manages our office, and we are a team.
My mom got up and said, I wanted Judy to marry a minister, but her dad wanted her to marry a doctor, so we got it all in one.
I really wanted to become a doctor at a very early age. I think it's because I have always wanted to be of service to people, to help them, to be a meaningful part of other people's lives. I'm a firm believer in if you help enough people achieve their goals, you will achieve your goals. Medical ministry means to me the ability to treat the whole person, body, mind, and spirit. That's what drew me to osteopathic medicine. Since I was now a minister and interested in your spiritual health, your emotional health, as well as your physical health, I wanted to put them all together. And I've worked 43 years now doing just that in Mountain View, Arkansas.
The first time I met Dr. Zini, he came to our Oklahoma convention.
He started going to the National House of Delegates, and that was out of our pocket at the time. And our pocket was pretty empty, but he was networking and learning ways that he could help Arkansas and bring better health care to Arkansas.
It's probably impossible to measure how many young medical students' lives and residents that Dr. Zini and his wife Judy have changed over the years.
We've always had a need for rural health physicians. We have had students come and stay in our home. We treat them as part of the family.
What the students got to see is a real physician practicing a broad spectrum of medicine. And I think what comes out of that is the students see that the real reason they went to medical school, and that was to make a difference, can really be fulfilled in a small community like Dr. Zini was in.
My hobby is antique cars.
For years, he has driven people in the Folk Festival Parade in his antique cars.
When you have a dignitary in your car, they're captive. We get to talk to them. I got to know Governor Clinton and, of course, Senator Bumpers and Marion Barry.
He talked to Bill Clinton about getting the first DO on the Arkansas Board of Licensure.
He appointed me the first DO to the Arkansas State Medical Board in our history in Arkansas, and I served 16 years on the Arkansas Medical Board.
It's always fun to hear him tell that story because it all fits together, the old car, the Southern gentleman.
It's rather exciting to have a small community like Mountain View, to have one of our resident doctors occupy these positions that are very powerful. But his actions and how he has handled himself has opened the doors for the future doctors. And now we have a school that he was instrumental in getting done.
I do remember in the 80s when we were sitting in our living room visiting with some of our DO friends, and he said, you know, my goal is to someday have an osteopathic school in Arkansas.
Dr. Zini played a big role in the establishment of the Arkansas College of Osteopathic Medicine, not only from his original dreams and commitment to the school, but in the way that he continued to plant the idea, not only with the osteopathic profession, with other healthcare professionals.
I think he's done an awful lot for the community. He's been a great public servant.
And Jim is the natural ward leader. He doesn't tell you what to do, he suggests it and you want to do it.
You'll find him on the sidelines of the football games, and he is always present, always there to make sure that the players are safe, and if they get hurt, he is the first on the scene.
In 35 years of covering this high school football team, I have never seen another doctor on the sidelines other than Dr. Zini.
Dr. Zini exemplifies the legacy of Dr. Tom Bruce, who spent a lifetime committed to making sure that rural Arkansas was served by high-quality healthcare providers. Not only did he serve as an anchor in the community, he also bridged the public health needs by being the county health officer and serving on the Board of Health in this important time of need.
He's just truly a light and just somebody who I so appreciate and who is inspiring to me to always be an advocate for rural medicine and also for what's best for the patients. I can't think of anybody better to deserve an award like this than Dr. Jim Zini.
He never stops. Being married to him has been a wonderful adventure.
I still feel that flame, that passion to help and to be of help to our state. And I thank you for honoring me so.
Dr. Zini, on behalf of our Arkansas Center for Health Improvement's Health Policy Board, I want to congratulate you on being a recipient of the 2020 Dr. Tom Bruce Arkansas Health Impact Award. Congratulations and thank you for your service. I also had the opportunity to go to Mountain View and present to Dr. Zini in person the gift and the award. We were appropriately masked and distanced. He had his family, his wife and daughter with him, as well as the mayor, the county judge, the publisher of the newspaper. It was a appropriately distanced event there at the Folk Festival Center. And Dr. Zini, we're honored to be able to provide you with this award. Both you and Kathy's names will be added to the plaque that stands on the wall at the front of our office to the other recipients of the award. But we are honored to be able to present this on behalf of the policy board to you. Let me give you the microphone for a response if you would like.
Wow, thank you very much. I must tell you that I've been told previously, be careful, you're giving an ordained minister as well as a physician the microphone, and watch out. I want to thank you and also give congratulations to Ms. Grisham. Wow, what a job you have done. I learned a long time ago to learn from mentors. I know that the real movers and shakers and promoters in life are those who see a need and try to fulfill it. That has been my motto from the very beginning of my career. In my life, it has started from and continues to be nurtured by my family. My wife, my daughter, my son, my grandchildren. I would not be here if it were not for them. Judy, who is even now at my side, is my partner, my best friend, and my anchor. I would not be here if it were not for her. I wish to thank those who have helped me be here today. I wouldn't be here if it weren't for them as well. Miss Miranda Morris, who is the executive director of Arkansas Allidaid ACO, and my practice is a member of the Accountable Care Organization, thought about me as being a candidate and mentioned it to Senator Irvin. Senator Irvin and her husband are friends of ours, and I think she does a wonderful job in doing what we all need to help the people of the state of Arkansas. I would not be here if it were not for my profession, though, as well, and the Arkansas Osteopathic Medical Association. What we have achieved together came about from my fellow colleagues. 35 years ago, 8 or 9 of us sat around at a meeting and said, you know, someday we would like to have an Arkansas Osteopathic College. What a dream. Many of others laughed at us at first, but we never gave up on that dream. We grew our profession together. I would not be here if it were not for my fellow colleagues, DO and MD. I would not be here if it were not for my ministry. My denomination has seen my work here as medical ministry, serving a rural underserved area, which was my dream. I would not be here if it were not for my community of Mountain View, who has nurtured us and accepted us and helped us grow together. And of course, I love my home state of Arkansas. I worked hard to come back and bring osteopathic medicine to fruition in our state. It has so much to offer, and especially in primary care, as we graduate mostly primary care oriented physicians. And of course, my patients. I stated from the beginning that my patients would make me or break me in my community. They have definitely supported me, and I support them. I try to serve wherever I see a need. I am honored, humbled, and privileged to ACHI. You represent, in my eyes, the advancement of what is best needed in our state and to humankind. I thank all of my mentors, and Dr. Bates is on now. I have had the privilege of working with him in the Board of Health, and I currently serve on the Arkansas Board of Health, and I was its president last year. Such an esteemed group, and I'm now a part of it. I just can't believe it. I am so humbled, so honored to be a recipient of the Tom Bruce Arkansas Health Impact Award. Thank you. God bless you. And I just want you to know, I'm not done yet.
Great. Thank you, Dr. Zini. Thank you very much. I want to thank all of you for being with us today. This is a little different. We may have to do this for a while. We will come back together as soon as we can. As you recognize, of our 21 members on our policy board, we have 3 that are stepping down. So our nominating committee will be meeting in a couple of weeks. And if you would like to put your name in for consideration or have others that you would like to, feel free to send those to us. As we take a quick look ahead for the coming year, we are in uncharted waters with this COVID-19 pandemic. And many of the epidemics that we had underway, whether it was substance use and abuse, whether it was mental health challenges, whether it was the distrust of the healthcare system by certain groups of communities of color and others, those are only getting worse because of the noise to signal. And I think our center will continue to try to be a source of trusted information. If any of you would like to join on our municipal league calls with local leaders, it really is enlightening. They are truly trying to lead their communities to a place of safety. And they ask questions many times I would never think that they might have, but just being able to have a discussion and to think about logically, how do we approach this while we are trying to develop the science and we're trying to develop the interventions that can help control it. If you'd like to sign up for our newsletter, we put our data out each week on Thursdays. I'll ask Sandra to put it in the chat box, or you can come to our website and keep up to date with what we have coming out. We are indebted to our partners. We're all in this together. I would encourage you to be smart and not afraid, and also to stay emotionally and mentally positive, but also to test negative. So with that, let me thank you all for being with us today. 2020 is a different year. but we are honored to have our new public health heroes join our esteemed list. Congratulations, Kathy Grisham and Dr. Zini. Thank you all for being with us. Be safe.